So let's now have a little look at meeting your baby. Okay. When you meet your baby, it's really great if you can use skin to skin to get that meeting off to a really good start. Skin to skin is now very well heard about. Lots of people know about skin to skin, and it's really well proven to help your baby in lots of ways. And it can be used beyond birth. It's not something that you just have to do at birth. You can carry on doing skin to skin in the first few days and weeks and beyond with your baby, because it just has so many benefits for them. But we do recommend having skin to skin with your baby straight away. So skin to skin really is the perfect start for you and your baby. So straight away what will happen is your baby will be born. We'll dry your baby and we'll place your baby straight up onto your chest and your tummy. We do position them quite low down, and we tend to do this position you can see in this picture here, which is kind of like a froggy position. You know, they're on their tummy and their arms and legs are kind of either side of them. We will make sure they're dry. We'll probably use a hat just to stop them from getting cold. We'll make sure you're dry as well. So if you're wearing any clothing at birth that's got a little bit dirty or wet, we do recommend you take that off so that we can keep you and your baby dry. It does stop your baby from getting cold in skin to skin, which is not what we want. We want the opposite. We want to warm your baby up really in skin to skin. We do know that if we do it properly, skin to skin will warm your baby up. So dry is a very important hat. And then once your baby's on your tummy, we will cover you both up with a blanket or a towel, just to make sure that there's no drafts getting to your baby and you know, they're nice and cocooned with you. We know it helps regulate their breathing, helps calm them down and slow their breathing down straight away. And also steady off that heartbeat. They've had a big shock. They've been born into the world and it was all a little bit strange. So it really helps calm them down. They recognise your voice, they can hear your heartbeat, and all of that helps to soothe them. It also helps to familiarise them with your bodily bacteria, which you might think is a really odd thing to say, but actually we all have we all have our own ecosystems of bacteria, something called the microbiome. And we carry bacteria on our skin, and much of that bacteria is quite healthy. And so transfer all of your bacteria to the baby helps familiarise them with their environment really, and it's really protective for their health, believe it or not. When they take on the microbiome, the positive bacteria, the healthy bacteria which you're carrying, they take that on, and then that forms the beginnings of their own microbiome. So it gives them a really good start. The microbiome is actually really, really integral to them setting up their own immune system. Healthy microbes are like a coding system. It tells their immune system what's good and what's bad. So it's a really good start for them. So skin to skin is really, really beneficial from this point of view. It also can start to trigger newborn feeding behaviour, which is where we're going to talk a little bit more about it. That's why we encourage skin to skin really for getting any feeding off to a good start, whether you're breastfeeding or not breastfeeding. It's really important. So let's have a little look at what it does and how this is important for you. So there's newborn pre-feed behaviour. It's an underlying process of imprinting, basically. It's kind of the baby learning to recognise his mother and familiarise himself with the breast and the nipple and how to feed. So it's really important learning opportunity, and it starts with your baby's birth cry. Obviously, all babies are going to give a big yell when they're born. They'll fill their lungs with air. They'll have that huge cry. But it is quite short-lived, that big cry. They calm down nicely quite quickly after the shock of being born. They will settle. Okay, so skin to skin helps speed that up, but they will settle. And they go into quite a relaxed state, actually. They usually stop crying, they'll go very still, and they'll just kind of take this moment in, you know, breathing, slowing down their heart rate, thinking, where am I? Their eyes might still be closed because it still feels a little bit bright to them, but they'll have a moment of stillness. And then gradually in their own time, they begin to wake up. They start to kind of move around a little bit. It might be that this is just still a few minutes after birth, really, but their eyes might start to open and they might start to kind of look for something. And very often they'll look for mum and their head kind of raise up to you. They get quite active after that. So they start to move around. They have mouth opening, hands and fingers will start to spread towards the mouth. They might start a few sucking movements, and that rooting reflex becomes a little bit more obvious here. So you might get some obvious rooting for the breast. This can then move into what we call the breast crawl. This is where they start to move their legs and they kind of push down with their legs, and their arms can push down into your body, and they can start to kind of move themselves over to one side or the other, hunting out the breast. And this breast crawl is a natural behaviour. At any point they can rest. So resting can happen at any point where they have been really active and then they go calm and rest. And resting is normal. And you might see more resting, you might see more episodes of stillness if you have had pain relief in labour, if you've had any diamorphine or anaesthetics. Sometimes that can mean your baby just takes a little bit more rest during this process. So it could be that your baby's been with you about 35 minutes now, and then they're really starting to wake up now and look for the breast, and they're getting a little bit, maybe what looks to be frustrated, but they're not frustrated, they're just learning. Very often they can be grunting, they can be really trying to root for the breast, and there's a lot of movement. So please don't mistake this for your baby not wanting you. It is just normal for them to look a little bit frustrated at this time. But this is a really important stage. This is familiarization. This is them imprinting, learning. I'm at the breast. This is what I have to do when I'm learning to feed, and this is how I get my milk. Okay, so it's a really important stage for them to move through. So kind of just let them do it. Don't feel like you need to intervene. Obviously hold the head if they're over to the breast so that they're supported, and just let them have that lick and that nuzzle at the breast. And what we're aiming for really is that they might self-latch to the breast at this point. If their instincts are raging, they're rooting, they're licking, they're moving, they're bobbing, they're crawling, they could do that themselves. Okay, so the least we do, the more they learn. So not intervening during this stage really, just letting them be there, is the most beneficial thing that you can do. If your baby, if you feel like you need some support, then we can help you. But hopefully your baby will latch and have a feed, and it's after they've fed and they've suckled at the breast that they'll go to sleep. And if you actually watch your baby during this process, you will notice these are quite observable stages. The baby will move through these stages. This is human behaviour, human baby behaviour. The problem is if we mess around with them while they're in skin to skin, which happens, and sometimes it's unavoidable and we can't do anything about that. But really what we would say is that we want to keep you both together for at least an hour. This is roughly, on average, takes around an hour, but sometimes it takes a little bit longer. For some babies it might be quicker. But really waiting until your baby's had a feed before you take them out of skin to skin would be amazing for them and amazing for you. So try not to have those interruptions really. If we need to weigh your baby, if we need to do any checks, ideally we could do them quickly at the beginning and then leave the two of you together to enjoy this time. So the key points really for this is that we have a hands-off approach. So kind of trying not to intervene. If sit on your hands, try not to touch. If dad wants a cuddle, then he can have a cuddle once baby's had a feed and you're starting to get ready. Trying to keep you both together and not separating you. Doing it immediately, as soon as possible. If it's not possible immediately, for whatever reason, reinstigating skin to skin, bringing the two of you back together as soon as possible so that you can start this process. Making sure that you don't feel hurried. Okay, so you want to be undisturbed, you want to feel like this is your time together and that you can enjoy it. So getting comfy, enjoying your tea, your toast, your coffee, your toast, whatever it is that you're having after your birth. Very well deserved food and drink. Remembering that if you have your baby in theatre, that's also a birth room. There's no reason why you can't have skin to skin in theatre. Okay, it might be that you don't feel up to it, and that's absolutely fine. But if you're feeling okay and your baby's okay, then we can do skin to skin in theatre, and you can come across from theatre into your room in skin to skin. We can transfer you both together. Again, aiming for that 60-minute, that golden hour. Okay, aiming for that as much as possible, or for as long as you want, or longer if needed. It's completely up to you. And ideally being with mummy, it's great that your baby can have skin to skin with your partner. And that's absolutely fine. If for whatever reason they do go to your partner, that they come back to you as soon as possible.